Katherine, during the inquiry seminars, we've heard some participants suggest that the nursing profession needs a royal college that focuses on setting and improving standards of nursing that's separate from its trade union function. What do you see are the arguments for and against reforming the RCN in this way?
It is a long-standing argument, and there are pros and cons. From my perspective as a regional nurse and as a chief nurse in an acute organisation, I found it quite beneficial to have a royal college who act as a union, because they have intelligence that I don't have at first hand, and they will bring issues to me at a time before they boil over and become a serious problem. So if there's a problem in the organisation with some members of staff, I will be told of it through that route. Without the college union thing, I don't think I would get that. There are negatives, and the negatives are in as much as if I say anything at the board in terms of quoting the Royal Colleges from its professional evidence base, they'll just say, well, it's a union, so they would say that. So I think it's a debate that's not concluded. I think it's a debate that we'll continue to have. I can see from a practical point of view the separation would be better, but I'm not so sure if nurses would pay into both types of organisations, and they would want to pay into one where they get protected, which would be a union.
Is there anything that the RCN could do around the way that it sets standards to improve their authenticity in organisations like yours? No. In a word, no. I think they've either got to separate or accept and work hard with us on the way that they do. It's building relationships. Nurse education's changed significantly over the past 20 years. Do you feel that it's now too academic to produce people who are willing to undertake basic personal care for patients?
No. I think caring and being intelligent are not mutually exclusive. I think we have to teach people research methods, and we have to teach them how to care. It's not, you're 18 years old, if you've got very little life experience, you know nothing. So caring is something, it's a skill that can be taught, and they have to also have really good role models, because they want to be able to observe what good caring looks like. But you can't have somebody who can, we have a very sick population, both in hospital and in the community. You can't have somebody who can care, who can't make critical decisions, and who can't have really good observation skills. You've got to have both. The technology is such, and the availability of treatment is such. You have to be able to do both.
Sounds from what you're saying that some changes are needed in the way that education and training for nurses is structured. What specific changes would you like to see put in place?
I think there's two things. If I could have my dream, there's probably two things. One is, I think we need a standard final exam where nurses are of the same competence academically and clinically at the end of their training, and we know exactly what comes out is what we want. The other thing I think we must have is a proper post-registration career pathway with definitive points, both academically and clinically, as they move through it, similar to medicine. If we could have those two things, it would make a huge difference to the calibre of the nursing on the wards.
Katherine, you're a chief nurse in a tertiary hospital, a teaching hospital. Perhaps it's inevitable that you're looking for those highly qualified nurses that are capable of and interested in research. What advice would you have for hospitals like Mid Staffordshire that's in a different position?
Well, I've been a regional nurse as well, so I've been the regional nurse over community hospitals and mental health institutions and DGHs. And I don't think you can practice as a nurse unless you understand the evidence. That's what patients deserve. They want, if they're at risk of developing a pressure sore, for example, they want to know that the nurse caring for them has got and is using the latest evidence base to do that care. I don't think all nurses need to be research active, but every single nurse out there needs to be research aware, otherwise they're not competent to practice. So and they're not doing patients, they're just doing patients a disservice if they're not using the latest evidence.
So even in small hospitals like Mid Staffs?
Absolutely, no question.
Research active?
Yeah.
Okay.
Even in the community, in a nursing home, if you're practicing as a registered nurse, you should be using evidence. I'm not saying that you need to be generating that evidence, but you should know about it and you should be using it.
In the previous seminar on organisational culture, we heard quite a bit about poor nursing cultures and what could be done. From your experience, can bad nursing cultures be turned around? And what do you think are the secrets to that?
You have to constantly challenge the culture in your own organisation. You have to constantly be open to others coming in to do that. What's important, I mean, I've just gone into an organisation, UCLH, I've not been there very long. You go in there and you see what people have got used to being the norm, and you have to challenge it. So I think organisations have continually got to expose themselves to external scrutiny. We do that in UCLH. Not only, obviously you've got CQC, but we have the chief nurses, a group of us, 9 of us in what's called the Shelford group, meet and we challenge each other's practice, and we invite each other into our organisation so that they can start to challenge those norms, things that become normal to us that become unacceptable elsewhere. It's difficult, but I do think poor cultures can be turned around. It may be that you've got to have a complete change in the leadership. The pivotal person for me in a culture of an organisation is the chief exec. Whatever they believe, whatever they espouse, however they behave, become the value of the organisation. So sometimes you have to change the chief executive.
Okay. Katherine, Fenton, thank you very much for your time today.